Last time we had dealt with certain questions like how to manage relapse of disease condition when patient has shown initial improvement, how to manage acute condition during treatment of a chronic case, how can we be sure that the patient is improving in all aspects during follow-ups. In system method, there seems to be a lot of interpretation. How to avoid interpretation? How can we elicit sensation method in patients who have limited vocabulary, or patients who have never observed themselves or their complaint in much detail? How to retake the case again by sensation method after having taken once and failed in first prescription? How do we restart since the patient has narrated the presenting complaints already? These are questions we dealt with, I believe. Yes? No? Yes. So we'll start with the further questions. Have we done this? In what way we can take case by sensation method in day-to-day practice where time is short? Yes? Already done? I believe so, no? Last time, no? No. Okay. Sure, we have not done? No. So, it is a concept that sensation method case taking takes a lot of time, and maybe hour, 2 hours, 6 hours, 8 hours, 10 hours, I don't know. But it's not true. I think it's very important to know at what level the patient is in. The concept of levels is very, very important and interesting. See, each one experiences his everyday life in a specific level. I was thinking about it myself. And you see, for my own self, I get lot of dreams. My whole night is full with dreams. And these dreams have to do with various kind of situations. Anxious situations, restless situations, hurried situations, whatever it may be. But there are situations. Not what I'm happening in my life, but in the dreams. Similarly, I find that whenever something affects me, so some anxiety is there, some excitement is there. So I will develop, for example, a couple of days ago I had some stressful situation. I started developing urticarial kind of symptoms. Means hyperimmune system response, allergic. So in this way, I find that I do not have any organic pathology. My all systems are good. I don't have any specific local complaints. I don't have a tumor, or I don't have arthritis or anything like that. But all my expressions are at a general level, hormonal level, immune system level, and dream level. Please try to understand this concept very, very nicely. I was thinking to myself that the most interesting of everything that I found was the concept of levels. Because a person who has expressions at a dream level and hormonal level and immune system general level generally does not have local pathology. Because that is his level, level 4. Similarly, a child, for example, tarantula child is there. Very, very restless, hyperactive, destructive, cunning, pushing people down, doing this, doing that, crazy restlessness. This child will hardly have any physical pathology. The patients will come to you for behavioral disorder. So that is at a sensation level. Whereas you will find a person with cancer, multiple metastasis, will hardly give you any mental symptoms, emotional symptoms. Hardly, you can't think of dream also. You'll say, what is a dream? One patient was there with prostatic cancer. I asked him, do you get angry? He said, never. I said, when did you last get angry? He said, 47 years ago. Means, can you imagine that is Staphysagria remedy? Very angry. But it was at a level 4, 47 years ago. Then it became level 3, level 2, and now it is level 1. Pathology, gross pathology. So in this way, by the concept of levels, you are able to know, as you take a case, whether this case will give you sensation or will not give you sensation. Now if this prostate cancer fellow, I keep pushing, keep pushing, tell me your dream, tell me your dream, tell me your dream. So he will not give you whatever you ask. So if he is not giving you the dream only, which means delusion, how he will go to sensation? Very, very difficult. Then you rely upon emotional symptoms, local symptoms and pathology. So it is not necessary that in every case you have to get to the sensation. Sensation is an option that you have. And definitely in many cases you will be able to get there. But don't push the patient. And when it is clearly available, you take it. Then it doesn't take time. It's the pushing that takes time. And it is of no use, because what you get by pushing, by torturing the patient, usually is a false. Because patient, just to get rid of you, will tell you some sensation or the other, especially the one that you like and you smile. This is very good. Doctor is happy. Let me tell him more of the same. So case taking should be an easy process, and that it's easy when you recognize the level and go there. So if he is telling you some local symptom, put your full attention on the local symptom. And then elicit all the symptom, modality, location, everything. Get your anchor over there. And then start exploring higher levels. Do you have a dream? Do you have a sensation? Then you can confirm. I find that I do not divorce a sensation method from a normal method. It's not, two are not different for me. Patient is giving you information all the time. This morning we had one patient. He had sensory neural deafness from 4 years age. He was 25 years old. And he came and sat just like this and didn't say one word throughout the interview. Not one single word he spoke. But relatives were there. I asked, tell me his nature. He is absolutely quiet, doesn't speak one word. Just like that he is sitting, just looking straight, not even no curiosity also. And what happened in his case, we found that when he was shifted from one locality where he was having lot of friends and acquaintances, from that he was put in a new locality, so he became almost crazy. He left the house and started walking, and he forgot his name also. So when you put this together, is it a symptom or a sensation? For me it is both. This kind of shyness, timidity, cannot take a new place, cannot answer, introverted. This is both sensation as well as symptom. It's a sensation and symptom both of Baryta carbonica. He received Baryta sulf, but it was very close. So I don't differentiate, is this symptom or is this sensation? They are both two sides of exactly the same coin. And as I told you maybe earlier, we have got one Phatak charitable clinic, and Gurukul I do once in a month. I have to hear the case taken by another doctor. I have to take the case and then I have to explain the case. All is done within 30 minutes. That means my case taking hardly lasts for between 5 to 7 minutes. And you are able to elicit beautifully symptom, sensation, everything. So it's a matter of experience. With time, when you keep practicing, the time taken gets shorter and shorter and shorter. Just like that. Many remedies arrived at by sensation method are recent provings which are not part of Kent's repertory or even complete repertory. How can we use the method when not having MAC or Vital Quest? I think it is worth having MAC and Vital Quest. It solves the problems when the solution is available. Huh? I want to fly from here to there, but how can I fly without having a plane? A plane is there, take a ticket. Anyway, well, you have to study sensation method through the books. The books are all available. There's 2 volumes on mineral kingdom called Structure, 3 volumes of plant kingdom called Insight into Plants, volume 1, 2 and 3, 2 volumes on animal kingdom. One is called mollusk and one is called reptiles. So you can study all this. And thus all the remedies, all those rare remedies are all given in these books. And then it's a process of your own discovery. Jan Cholton's books are there on mineral kingdom. Jayesh's book is there, Insight into second row of the periodic table. So without knowledge, and if you still don't want to read the books, then you will have to do the work yourself of understanding each family of plants or class of animal. What is common? Means you have to start using your own creativity in terms of, for example, what is common to Compositae family? Compositae is arnica, no? So it is a injury, soreness. You will find this in arnica, in Bellis perennis, in calendula. So many remedies, chamomilla, senna. So you can derive a common theme and then start studying the different remedies from the repertory and see what comes commonly. Similarly, in opium family, which is papaverese, the common theme is extreme pain or extreme anesthesia, painlessness. Study this in various remedies. Study the individual symptoms of each of the remedies of papaverese family. So you will be able to understand much more. So only by study of books, all this is in Vital Quest, for example, all this is readily available. So your effort is saved. But you can do it yourself. Just you have to understand the concept first. Then things will come easily. And it's a matter of searching. I'll give you one example. There was one child. I gave, first the child was beating everybody, very capricious, very cranky. I gave Sina. Didn't anything happen. Then I found the child is very restless, very stubborn, moving about. I gave tuberculinum. Nothing happened. Then I thought, I have here features of Sina, but the hectic activity is like tuberculinum. Can I find a remedy of the Sina family which has emaciation and restlessness like tuberculinum? And the remedy I found was abrotanum. That worked beautifully in that case. So in this way you have to use your mind. When you find family is good, but I don't know the remedy, then study each individual remedy. Very nice. And then you learn more and more. You can learn more remedies than what I have found. You might able to teach me. Yesterday I was reading one article from Hepathy. Hepathy, you know this journal? Yes, no? Yes. It was in August issue. You read an article is there on sensation method, and it was written by one doctor, I forgot her name, and she had mentioned that it was in this family and this remedy. It's a remedy I didn't know. She has given and very good results, and how she found out and all she has written. It was fungi family, I remember now. She was thinking of Bovista, but then another symptom gave her a clue to another of the fungi, and she gave that. And she is very well described, and she has described the connection between the source information and the patient information. What the patient said and what this fungi, I think Justilago, I think she had given. Try to read that case, because it's a case where I wouldn't have prescribed. So, in a way, very important as a homeopath that you have to go beyond known knowledge, create your own knowledge, and then share it. Then you also write one article in Hepathy that I found this remedy. That way our knowledge base will grow. How are we sure that we have explored the case in detail and in depth? It's a very interesting and very important question. How do you know that you have gone deep enough? I think there are 3-4 ways I can teach you. The first way is that as far as symptoms are concerned, you have to be very precise and very exact. Very often I find students are young practitioners also giving importance to very common symptoms. Fastidious, contradiction aggravates, weeping easily, consolation, pulsatilla. Carcinosin, netramore, sepia, same to everybody. It's not working. You have to understand what is peculiar in that person. It may be a headache, it may be a dream that you don't understand. Doctor, I had one patient who said, doctor, I saw a dream in which I was walking in the passage and one dog came and jumped at me, and I hit the dog just to deflect it. I was not violent, just to deflect, because it was jumping towards me playfully. I tried to deflect the dog. When I deflected the dog, the jaw of the dog came out and fell on the floor. Okay? That was my dream. Now what does an average homeopath do when he hears this dream? What he will do? Usually, huh? What? Dream of dog. That is very, very clever homeopath. I'm talking of average homeopath. An average homeopath will simply ignore the dream. Maro goli. Forget it. Who cares? I don't understand. I have not read in Materia Medica that jaw drops and all that. Forget it. So this person will remain always average. The one who ignores the peculiar symptom will always remain at that level only. Who will be a good homeopath? Who explores the peculiar. What you don't know, that is the peculiar, no? Every day you hear, huh? Mother-in-law is a bad woman. Is it common or uncommon? So, कोई बोलेगा she is a very good woman, then you take it. Insanity thinks mother-in-law is a good woman. So, don't explore the common, explore the uncommon. So then I asked the patient, so you tell me, what about this jaw? Only about the jaw. So, no, jaw, when the jaw fell on the ground, so it became cut into two pieces. Like this he's showing. Jaw get cut into two pieces. Tell me about the two pieces. Two pieces means exactly symmetrical. It was like sharp cut. So that two pieces were there like that, exact opposite of each other, exact mirror image, two pieces. This is funny, no? So the dog was not there anymore in the picture. It was two pieces that was exactly symmetrical. So tell me about these two pieces that are exactly symmetrical. So he's saying one is like this, means, and one is like this. And when they come together, then they form a whole. Then I said, tell me about this whole. This whole is like, it's like it's something round and it's a complete. I said, tell me about this whole and round and complete. Oh, this is a protection, he's saying. It's like a wall, like a protection. And tell me about this wall and this protection. So inside you feel very safe and comfortable. But then you also start feeling little bit bored, no, inside what to do. Then you feel that you should open it a little. But when you open, maybe there is some danger, then you close again, open, close again. So what do you mean? Like a shell, no, he's saying. It's like a shell. Now what is interesting is that he had brought his wife along with him. And his all problems started when the wife fell sick. So she had some severe problem, heart problem, kidney problem, बहुत terrible problem. Now, when she fell sick, this guy got aggravated. So I said to him, what you felt when your wife got sick? So he's saying, when my wife got sick, I got very anxious. Because how I live without her? So what do you mean by that? So ever since we were in 4th standard, we were already dating each other. And from that moment, I swear he said that. अरे वीडियो में है, don't believe me. This is crazy. वीडियो में बताया. I can show you also. So from that time, they have been together now, God knows, 20 years or they're young people, like must be in like 30, he must be 30 years old. 24, 25 years, he's just held on to this woman like that, not one moment gone away. Yeah, so I said, so strange, no? You consider strange or healthy? Strange, yeah, that's what I thought. तो उसको कुछ something happens to her, he get completely. So what the experience with her? I feel completely safe. What is safe? Safe means like this, protected. Again, come to the same. So how do we know we are at the depth? When different phenomena come to the same point. Then there was one more dream. Again, in that dream, he saw a lot of people coming towards him. And then suddenly, the people were above him and the people were below him, and he was in some kind of a ball or a cocoon inside, in which he felt safe and exposed. So, when different points, unconnected aspects of a case come together to the same point, and especially when the most peculiar thing of the case and when the most exciting factor of the case and when the chief complaint of the case and the fears and the dreams of the case, everything comes to the same point, completely unconnected things bring you to the same experience, then and only then you know that you are right in the middle of the case. So you can almost predict that any question you will ask him, you will say, which movie you like to see? He will again come back to the same security, protection, and so and so. Somehow or the other, वो लेके आएगा. Many times we used to consider this as a kind of challenge earlier times. I tell this case again and again, so I will repeat it. When we were making Vital Quest, at this time sensation method was a little bit in a formative stage. And the idea that there is one sensation that prevails the entire being, that was sure in my mind. That time Dr. Paresh was in my clinic and he was making Vital Quest. So one old fellow gentleman came in, said, I've got itching since last 25 years. Itching, but describe the itching. Now, very important in a case taking, never to assume anything, never to take anything for granted. You must come from a position of I don't know. What is itching? Itching for one person is different from itching for another person. The sensation, the location, the speed, the occurrence, the exciting factor, very, very different. So this man had chronic itching without eruptions for 20, 25, 30 years. I've been to every specialist, every allergy specialist, everything, nothing worked on him. So he was really in a miserable state. I asked him, what is itching? The sui bhokta, like needles, sharp needles, or either, sui, poking me everywhere. Torture, says torture. Then, very good. I tried to elicit some, but this is all that I could get sensation. Oh. Then I asked him, what is a dream you are getting? So he's saying, I am getting dream of stool. Shit, You know or you don't know? You look as if only I know. Last week, I went to see one patient with dysentery. She was very exhausted and all that. So, one of my colleagues was following up the case. I asked her, how is this patient doing now? She's saying, patient is nearly completely all right, except for some music in the stool. Instead of mucus, she wrote, except for some music in the stool. I am very fond of music, but this was a little thoda. I wrote back immediately, I wrote which raga was playing. So she said, I don't know, we will have to give it a new name because oh naya hai kuch. So we were just joking. But anyway, so this patient had dream of stool. So I looked at him. Then Paresh looked at me. What? How this dream of stool, how is going to give the same sensation like in the skin? कैसे होएगा? He was looking at me. I know his question was in his head. So I also answered with my head only. I said, you will see. We will ask him. I say, what you call extrasensory communication. Huh? So I asked him, so tell me about the dream of. So I'm very confident that all the experience of the patient come to one central point. It is true. That is called vital sensation. I've been telling you about dream of stool. So patient started to laugh. Ha 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 ha. I also laughed. Means he thought it was very funny. मतलब ये क्या stool doctor वही होता है ना वो stool. I said, yeah, tell me about it. Then he said that, in our religion, I think he was Jain or whatever it was. In our religion, dream of stool means you have done some bad deed in your life. And I don't want to do any bad deed in my life. I said, why not? He said, because then you'll go to hell. I said, what is hell? Hell, you don't know, doctor. You go up and they sui, they poke you everywhere. The terrible torture. Same story like a skin. So when you come to the same point from very diverse aspects of the case, then you have explored the case in depth. As far as sensation is concerned, as far as symptom is concerned, you have to explore each symptom and genius of the case in as much detail as is possible. And that requires really very, very much patience and exactness. Two things very important, exactness and patience. And don't keep any remedies in mind. Just explore the peculiarity. Suppose the patient says, I have this headache or asthma or cough, whatever it may be. Explore to the last detail, exciting factor, aggravating factor, location, sensation, modality, and especially concomitant. Exactly. Look, where does it go, from where to where to where? Very beautiful. Okay. How to approach in one-sided or local diseases like vitiligo or alopecia. Well, of course, these conditions are challenge because you don't get very often anything to do with location, sensation, modality, only pathological. But try to understand both if you are talking about alopecia areata especially, and not just male pattern baldness and things like that. So then these are, remember, both of them are autoimmune disorders. Try to understand that very, very clearly, that you are not treating the vitiligo, you are not treating alopecia areata, you are treating the autoimmune disorder. That means the immune system of the body, instead of fighting external factors, is fighting the body. It's gone crazy. Immune system is fighting with himself. That immune system has to be put in order. Otherwise, forget your vitiligo and alopecia, nothing will happen. How to put that immune system in order means your concepts must be clear, that immune system is connected to nervous system, hormonal system, and especially the mind. They form a cabinet, these four systems. Immune system means defense minister. Nervous system, information minister. Hormonal system, home minister. Mind, prime minister. Four ministers form the cabinet of the body. The body the cabinet decides the policy and the perception and reaction of the entire cabinet. The cabinet decides, and each ministry, suppose the cabinet says aggressive, we are not going to take anything lying down, we are going for it. So defense minister will go for it, information minister will go for it, home minister will go for it. Suppose the whole cabinet is very active, do it, do it, do it, everybody will be do it, do it, do it, do it. Suppose the whole cabinet has a very dull, kal dekha jayega, everybody will be like that. Now we have to understand what is the mood of the cabinet, the state of the cabinet. How do we understand? By looking at what the Prime Minister is saying, by looking at what the information minister is saying, what the home minister is saying, what the defense minister is saying. By studying all the statements and symptoms of these four ministries, which we call the generalities in homeopathy, we'll understand the mood of the cabinet. And that is where we have to match the remedy. And when you match the remedy at that level, 100% it will work. Otherwise, chances are very little. Try to give arsenic, sulphuretum, flavum to all vitiligo cases. 1 out of 10 might improve for a time being. But try to give the exact remedy of the state, 8 out of 10 will get better. How to understand that? So definitely in these cases, especially in vitiligo and alopecia areata, go for the mind symptoms, go for the dreams, go for the cravings and aversions, they are the nervous symptoms, go for perspiration, go for menstruation, go for the generalities. And definitely you will get symptoms at a general level, because the immune system has a problem. It must be a part of a problem of all these systems, nervous, hormonal and mind. Go for the dreams and you will get very beautiful case, very beautiful case. These are very easy cases to treat for a homeopath. For allopath, very, very difficult, because he doesn't understand the concept of holistic health. We understand, so it's easy for us. And generally results in alopecia areata and in vitiligo are good. Definitely they are very slow, especially vitiligo, very, very slow. Takes months, but you are able to stop the progress and start reversing with a period of time. But you have to keep your focus always, always, always on the mentals and generals in these cases. If in a case, suppose you have got just warts and you are not getting anything at mental and general level, then it's a different story. But usually you will get. And again, exactness, very, very important. I'll tell you the first case of vitiligo that my colleague treated, Jayesh, how he treated. Well, one girl came with vitiligo. Then he asked about all the other symptoms, but nothing, only one mind symptom. She said, you know, this girl has very strong opinions, and if somebody goes against her opinion, she starts really disliking that person. Don't want to look at their face. Now you can take this as contradiction and all that, right? But he didn't take like that. He had tried to understand exactly what she's saying. And then she says, for example, she got into an argument with one friend of hers in a friend group, that at that time Indira Gandhi was Prime Minister. So he said, Indira Gandhi was a good woman, the friend said. She said, no, Indira Gandhi is very bad for the country. Her policies are terrible, everything is terrible. And the friend said, not at all, I completely disagree with you. Indira Gandhi, best woman, best Prime Minister we had. From that time, she left the group of friends. She said, nobody appreciates me and my views over there. And this particular one who didn't agree with me, I don't want to look at her face for the rest of my life. This was her narration of the other people. So in this way, he took the rubric hatred, and then under that, where shall we look? Hatred for persons who do not agree with him. And then you have one remedy there, calcareous sulph. And the same remedy has a second symptom, lamenting. Under that, appreciated because he is not. Then you have calcareous sulph. And the same remedy also find incidentally in the rubric white spots, vitiligo. Oh, it's not there, lucky, huh? So it doesn't have to be there. So teaches us a good lesson. So he gave her calcareous sulph, beautiful result. Over a period of time, she improved very nicely. So you can rely very, very much upon the person's individual symptom, much more than remedies that are known for that pathology. Those are clinical symptoms, but you can rely more on the real symptoms. Really fantastic. Have your concepts very, very clear, what you are treating. Okay. I had a case of tinea corporis, wherein based on repertorization I came across China as the remedy. Now China belonging to the malarial miasm can be given in a ringworm case, miasm case, or okay. Now I think I have to break up the question because it's too long. Now it's given, now China belonging to malarial miasm can be given in ringworm miasm case, question mark. Now what is important here is that to have a case of a ringworm infection, tinea corporis, does not necessarily mean that the person belongs to the ringworm miasm. China has to be given only in a case of malarial miasm, but a person with malarial miasm can also have ringworm infection. A person with cancer can also have psoric miasm. A person with TB might well be psychotic miasm. A person with leprosy could very well be ringworm miasm. So the miasm and the infection are not synonymous. The infection represents the pathology, the miasm represents the state of the person and the way in which he sees and copes up with the situation. So if his attitude is one of being persecuted, harassed, intermittently attacked, he belongs to malarial miasm, even if he has a ringworm infection or a TB infection or a cancer. Okay? Or else we need to choose a remedy for ringworm miasm from the same. No, not necessary. If you are convinced that he is a malarial miasm, please you have to give China, whether he has ringworm infection or not. So I had a case of tinea. Oh, it's the same thing again. Oh. Okay. Ask the same question twice. ऐसे rubric होएगा इसका. Or maybe I put it twice. I don't know. Anyway, during day-to-day practice, we find that many patients. So, for example, very good example is that we treat a lot of cases of cancer with thuja. Thuja is a very big remedy in cancer. But thuja is psychotic miasm. In that way, many cases of cold and cough, recurrent cold and cough in children, which you might think is tubercular miasm, we give carcinosin because the child is very perfectionist and fastidious. So it is the attitude, the state, the speed and the intensity of the patient that decides the miasm, not the pathology. I hope this is clear. During day-to-day practice, we may find many patients who don't give a good history, or we are not able to derive good history either way. How to prescribe when there are almost no individualizing symptoms in a case? Well, refer them here. हम निकालेंगे. It's a difficult question to answer because you have to find individualizing symptoms. Otherwise, you are taking a chance. Then you will be giving one remedy, fail, another remedy, fail. Luck by chance, mil gaya to mil gaya. That's what you will be. So every person, by definition, must have individualizing symptoms. How you elicit, that's what you have to learn. If you can't elicit, you give whatever best you can, but then it's always chance. So the whole idea maybe of the course or your learning is to elicit individualizing symptoms. And the clue for that is the levels of the patient. If the patient is at level 2, you will find the individualizing symptoms locally. If he is at level 3, it will be at emotions or dreams. So, it is like asking, this question is just like asking, I didn't find any clues in this murder case, so whom should I hang? It's the same question. Okay, you hang one guy, see. If the murder stops, good, otherwise hang the second one. 10-12 को hang करो. How can I explain? ऐसे ही लटकते रहेंगे एक के बाद एक और फिर भी हो रहा है मर्डर. So you have to find the clues. How can you ask a detective without clue, how do I find the murderer? Find the clue. So that is the thing. And then of course, you see, I'll give you my first case, because I shouldn't give you my most recent case. I should give you a case where I started my practice. This was the second patient I had. He had come with renal failure and he had a transplanted kidney. Kidney was failing and he came with carrying. And when he saw that I was only 21 years old, he wanted to escape. Didn't even want to see me, but he said, I was not going to let him go. I kept him there and he was not willing to give any history also, because all his interest was to go away. But I kept on asking him, tell me about your appetite, thirst, urine, stool, sleep, sweat, dreams, mind state. This is what I had learnt. So by process of asking and observing, 2-3 times after having asked him, finally I got 2 symptoms. One is, he said, my seminal discharge is bloody and I can't understand it. And second is, when I sleep, I salivate. These were good enough to give him mercury. Very beautifully he did. So you have to persist till you elicit symptoms at the level of characteristics or mind or whatever it. Later on, I tried to find so many ways in which to get symptoms where it's difficult to get. And we have devised also many techniques of, because you see, necessity is the mother of invention. No? You know this statement? One day I was giving one lecture to some foreign students. Their whole group had come. That time I was very heavily into delusions and dreams. And they asked me what to do in a case which doesn't give any delusion and dream. What you will do? I said it is not possible that somebody doesn't have delusion and dreams. Everybody get dream. You have to only persist. Again and again you ask, what dreams you get? No dreams. In childhood, what dream you got? No dreams. What was the scary dreams you got? No dreams. What was the nice dreams you had? No dreams. What are the daydreams you have? No dreams. You have to persist. I told them, if you persist, you will get. Okay. Then I had a live case immediately. Very difficult nut, fellow. 20 minutes I grilled him. Are think some dream. Sir, by this time I was desperate. I had just made such a commitment there. And here I was stuck with this complete obstinate guy. I didn't know what to do. I had to do something. Then I asked him. Now, this is where, necessity, mother of invention. So I asked him, suppose there is one dream that you don't want to have. What is that dream? He said, this doctor I know. I don't want to have a dream that I'm sitting in a double-decker bus and I'm just driving over the bodies of people with all the blood splashing everywhere. This dream I don't want to have. I said, very nice. So, when you are convinced inside that there must be something individual in each person, then you will elicit it. Isn't it so? Yes or no? You must have the common experience that you lost your key or your some other necessary thing. And you are very sure that it is there, you have lost it in that particular place, isn't it? As long as you are sure, you will somehow find it. But if you are unsure that it is there, you will not find it. Am I right? It may be right in front of your eyes. Same way, when you are sure that there is individualizing symptom, you will search and you will elicit it. And in case you don't get a symptom in the present, you have to look for a symptom from the past. Suppose patient says, right now I have azoospermia, okay? My sperm count is very, very low, you treat me, I have no symptom, everything else is good, my sexual function is good, everything good, only my sperm count is 0. Now you treat for that, for example, or low, maybe not 0, maybe oligozoospermia. Then what to do? Then you have to trace the history back to a point where there was an ailment which had individualizing symptom. In this way, there was a very famous case of Lippi in which there was a impotence. That guy had no other problem but impotence, and there was no symptom except that he didn't get any erections. And Lippi traced the history back that many years ago he had either diphtheria or tonsillitis, and the pain shifted left to right and back to right and left to right. So he gave lac caninum and cured the impotence. So this is a very landmark case in homeopathy which tells us that if you don't get the characteristics in the present moment, go back to the past and see at what point the body showed individualizing symptom, prescribe on that, the last one, and usually you will succeed. In cases of autism, where the patient cannot give the exact sensation or experience, and the parents who in a majority of cases give the reaction of the patient but cannot describe the sensation or experience accurately, then how to go ahead with the case and give the exact simillimum? Well, this is a case in autism, it is a case in so many other, in small infants also. Where can you get an exact sensation in infant? You cannot get. What about dogs? Very difficult, no, to get sensation, or dreams even. I don't know, dogs have dreams, you think? You ever asked this question? So then, how to get? Means you don't have to get what you cannot get. You have to get what you can get. And what you can get in children, in infants, in dogs, is the observation of the attendants, not their interpretation, not their theory. that this child is jealous or this child is stubborn. This is not what we want. Exactly what you observed. Exactly what are the aggravating factors. They'll say, every time the father of this child goes out of town, then the child gets aggravated, for example. So you know that there is something to do with attachment, separation, sensitive spot. In this way, you have to observe the modalities, physical modalities, emotional modalities, behavior, several other physical symptoms, characteristics, pathology, all the information that you get together. In autism, definitely the behavior of the child. Praful Barwalia is a colleague of mine. You might have heard about him. Done beautiful work on autism, and he has got, in fact, a whole institute called Spandan in Ghatkopar, which deals with a lot of cases of just mentally challenged children. And he divides autism into different types, like very active, very passive, aggressive, restless, quiet. So you have different individual features of autism, and definitely from that you can find a remedy. We have very good results in autism, very, very good results. But you have to, for example, you may get a case of a child with extreme terror of darkness in autism. You might have a case of a child who's completely silent and totally non-communicative. You may have another who is extremely restless and jumping all the time. So observe the sensitivities. And finally, of course, very important, to observe the mother's history during pregnancy. The exact physical symptoms, emotional symptoms, cravings, aversions, life situation, dreams, fright, etc. will give wonderful clues in children. And if you can correlate that with the child's current behavior, so the mother during pregnancy, the husband left her and went away. She felt extremely alone. Whenever the child's father leaves, the child feels extremely aggravated. Then you go to the mother's history. What did you experience exactly at that time? From that you may able to prescribe for the child. So the sensation the child does not verbalize might be made clear from mother's history in pregnancy. In this way, we can find a way out. The results are very encouraging. Autism is definitely a very strong forte for homeopathy. I think the last question we'll take. People whose educational status is poor and who cannot describe the exact word of his experience or sensation, then how to get the exact simillimum? Well, I found that the educational status is irrelevant to a person describing his experience, symptoms or sensation. In fact, I found that people with less education describe it much better, many times. What is important is to explain to the patient, because they are not used to it. An educated patient is more used to coming and talking about his mind state and this, and they are used to doctors. But a poor guy sometimes with poor education or poor economical status also, he goes to the doctor and says, "Bhai, mere ko darad hota hai, dawa do, give me medicine." And the doctor puts one most painful injection, which means effective. I've heard from general practitioners, they have very thick needles, because the poor guy believes the more painful, the more effective. But when they come to a homeopath, you want to know things. So it's very important to explain to them that in their own words. That's very important to know your experience. And they give just beautiful symptoms. Because everybody experiences, no? And if he can speak, he will express it. Take your time, explain, and you will get it. And if you are not able to get, I told you, in certain levels of patient, like level 1 and level 2, you may not get sensation. Go by symptoms. But mostly, education and economical status are not impediments to giving a good history. This is what I found. Oh, more. Lot of questions. Very good. But we will do it another time. Let us digest this much, for today. What do you say, Homeopathy is fun. Homeopathy is effective. Homeopathy is easy. What is important are three things. One is clear concepts, good knowledge and skill, which you have to develop through training and through learning. And the third is a good heart. Maybe that should be first. Means, I think the most important qualification of a physician or a homeopath is the love of the patient. That's what ultimately is healing. If you are able to feel one with the patient in front of you, I'll tell you a stupid experience which I had just 3 days ago. One little dana, must be some dal or God knows what it is, got stuck on my foot. And I walked and I found it was poking me inside. I was uncomfortable. Ultimately, I discovered the source of the problem. I got rid of it and I was fine. But then I thought, imagine the guy who has painful corns on his feet, which cannot be brushed off. Imagine the guy with an ulcer on the foot. Imagine a guy without a foot. If that little dal ka dana could give me trouble, imagine this guy walking for years together with that painful foot. Can I do something to help? If not anything, can I at least listen to what he has to say and experience his pain for that few moments? At least I can be there to listen. This attitude, I think, is what really drives us to do what we are doing. Everything else will come automatically. Once this desire is there, his pain is my pain. Let me see what I can do.